So once again, we are dialing out to about 35,000 households around Fort Collins, and we appreciate your participation tonight. When we get started, you'll hear from Mayor Wade Troxel and City Manager Darren Atterbury, and they're here to give you some updates and then also to answer your questions. So if you're just joining our live teletown hall, be thinking about questions you'd like to submit for Q&A, and as soon as you have a question you want to submit, press 0 to speak to an operator. If you're not comfortable asking your question live, be sure to let your operator know that, and they'll let me know that you want me to read your question over the air instead of bringing you live. So we're happy to bring your question live and have you ask it live over the air. If you're not comfortable with that, again, just press 0, talk to an operator, and let them know if you want me to read it instead of bringing you live. Thanks again for joining this live City of Fort Collins Teletown Hall. 0 is the button to push to submit a question. 7 is the button to push if you'd like to get email updates from the City of Fort Collins moving forward. We see quite a few people doing that right now, so if you're pressing 7, just be patient. We'll get an operator with you as quickly as we can, get your email address, and get you signed up for email updates. So once more, 0 for questions, 7 to give us your email address for updates. It's my pleasure to turn over this live teletown hall to your City Manager, Darren Atterbury. Go ahead, please, Darren.
Thank you, Ian. As Ian just said, Darren Atterbury, City Manager. I want to welcome everyone this evening, and thank you for joining us. I'm joined tonight by Mayor Wade Troxel and Larimer County Health Director Tom Gonzalez, as Ian had said. I want to start with just a bit of a personal reflection. This is a very important issue for our globe, for our country, for our state, and certainly for our community and our neighbors. And I want to tell just a real quick story that might help set some context and maybe sort of pull back the curtain a little bit as I'm playing my role in this leadership journey in the community. About 20 minutes prior to our city council meeting last Tuesday night, the mayor and I and Councilmember Gorgel and Mayor Pro Tem Stevens and Councilmember Summers were given a heads up that we needed to go into self-quarantine because we had been at a meeting in Washington, D.C. doing the city's work at the National League of Cities. And since that time, I've personally been on a quarantine. And it started in a hotel on Tuesday night because I have a family member in my household who would be considered at risk if he were to come up with the coronavirus. And so as of Saturday, I came out of that hotel and into my home with my family. That family member and I are staying separated in our homes. But I call it a city manager in a box. Being in a hotel room for four nights, they were very gracious, the hotelier, and but you know, I did my work as the city manager for Collins 100% virtually. The other context I want you to know is that I also have an elderly mother who lives in Albany, Oregon. She's 80 years old. I also have a family member who is unable to work because she's in a restricted industry as required by the governor and stressed by the president. And you know, we've been trying to be physically distant as people talk about, but yet socially connected. And so how we stay connected to these folks with all these fears has been really important to us. And I just wanted to share that context that all these unique challenges that I've faced as a city manager and personally, there are so many more in our community, and we want to just acknowledge that as leaders and say that we too were confident we're going to get through this. We think we've got good systems and good people in place. We know that communications and being consistent at communications is vitally important during this time. So we wanted to host this town hall event at a time when people are uncertain and even afraid. We've developed a community newsletter that you can sign up for at fcgov.com/coronavirus. This will really be the best place for you to stay up to speed about city efforts to help our residents and businesses through this difficult time. There are a lot of great resources that our economic health folks have put together for business as well. So please do take a look at that and keep that bookmarked. The city organization is working closely with our various partners, including Larimer County. Tom's on the phone here, and you'll hear from him in a moment. The state of Colorado and federal governments to follow their latest guidance. This includes our businesses, our institutional partners such as Colorado State University and President McConnell, and Poudre School District, the Superintendent Sandra Smyser, and with our healthcare providers in the city to help our residents get through this tough time. We are all working closely together. We're spending many meetings together, not physically together, but online. So being able to deliver city services throughout the duration of this pandemic is at the forefront of our minds, and certainly mine as the city manager on behalf of the mayor and city council. I'm grateful to my 2,400 colleagues who continue to answer 911 calls, provide reliable electricity, clean water, broadband services, and other vital services. I also want you to know that we are doing everything we can to lead by example in these physically distancing times to keep our coworkers healthy. If we don't keep them healthy, it's going to be very difficult for us to deliver world-class municipal services during this time where many of our services are provided now virtually. So my coworkers are working tirelessly to improve the service delivery and to help you be able to abide by the guidelines that you've heard from the governor and from the federal government. As many of you likely know, city facilities remain closed. They're currently closed for the public. Anyone who needs assistance with a city service is encouraged to call the appropriate department. If you're not sure who to contact for your issue, please call 970-221-6500. That's a general number that we have set up. If you have an emergency, 911 is the number to call. We also want you to know that we'll be working on a Spanish language live question and answer forum. We're working on that. We are unable to secure translation services for this event, but we recognize the importance of reaching out to all residents in our community at this time, and we will commit to providing that in Spanish language. So with that, I'm going to turn it over to our Mayor, Wade Troxell. Mayor?
Thanks, Darren, and good evening, everyone. Thanks to all of you for joining us tonight and staying on the line, and we look forward to answering your questions. I want to echo Darren's sentiment that we are committed to providing the community clear communications during this very challenging and certain time for all of us, and we'll do it for as long as the situation lasts. I want you to know that the entire City of Fort Collins government, from the City Council, the City Manager, the City Attorney, the executive leadership team of the city, and the entire city staff, we're all doing everything we can do to provide and be diligent, reliable, and responsive while keeping our community safe at the forefront of and keeping the community at the forefront of our decisions. We are working closely with our local partners, as Darren mentioned, to address the needs of our most vulnerable populations within our community, particularly around food insecurity, language access, and homelessness services. Within the last week, the city has transitioned the Northside Ocelans Community Center into a 24/7 shelter where homeless individuals can safely stay and distance themselves at least through April 10th. Fort Collins has always been a community in which the people care about one another, and this situation is no exception. I encourage residents to visit fcgov.com/volunteer to learn more about the opportunities to adopt a neighbor and to assist those who may be at an increased risk. This is very much in the spirit of Fort Collins of neighbor helping neighbor. I also want to stress the importance for everyone to practice the recommended actions to keep yourselves and others around you healthy. Now I have Tom Gonzalez will talk to us in just a moment. But this includes that we need to be mindful about those when we are out and those around us when we are out buying groceries or supplies. And please do not panic buy or stockpile goods and supplies. There will be plenty to go around, and please be respectful of others. We can't talk about this health crisis without also talking about the massive impact that it will have on our business community. This city will continue to identify resources for local businesses and will continue to coordinate with regional partners to field questions from businesses during this difficult time. And we'll also connect them to the resources, whether it might be state or federal, during this time. Please keep our local businesses in mind as you make your spending choices over the next several weeks, and please support them however you can. And I'm grateful to live in this wonderful community. We will get through this challenging time together. I encourage all of you to keep supporting one another and doing your part to stop the spread of this disease. And with that, I'll introduce Tom Gonzalez, the Larimer County Health Director. Tom, thanks for being with us here tonight, and thank you for your partnership.
Thank you, Mayor, and thank you, Darren, and thank you, everybody that's on the call. As Mayor said, I'm Tom Gonzalez, Public Health Director for Larimer County. First, I want to thank everyone for their patience and flexibility during this unprecedented time. The objectives of my brief overview is to give you all a situational update of COVID-19 restrictions during the COVID-19 response, and then give you a little overview of our local public health response. Current situation updates, and they change just about every hour with this response, is we now have 34 positive COVID-19 cases in Larimer County. We have an Estes Park resident that is being counted as a Boulder case, but is at their home in Estes Park. We expect to see more cases in the upcoming days, with many tests pending in our community. The current case count in the U.S. is just over 43,000, with 533 deaths, with 600 of those cases in Colorado and unfortunately 7 deaths. Current restrictions during the COVID-19 response: state health issued orders to close salons, spas, tattoo parlors, bars, gyms, in-house dining for restaurants. School closures from preschool to 12 are ordered. Orders temporarily suspending elective and non-essential surgeries and procedures. Orders to cancel all events for over 10 people or more. Avoiding all non-essential travel. Travel in and out of the community is highly discouraged. Accommodations in Estes Valley are closed until April 17th to try and discourage visitors to our area. State lab doing testing is behind. Tests are now taking 5 to 7 days. While tests are pending, persons tested and household contacts are asked to self-isolate at home. We are not notified about pending tests. I did learn today that some expansion on private labs is happening for testing, which is good news. We are looking here. I've got a strike team together in the Emergency Operations Center that is looking at alternative testing sites, because we think this is important to get more testing available to northern Colorado. And we have a team of highly trained epidemiologists. We're looking to the School of Public Health at Colorado State University for help and assistance, and they're providing that assistance. Because as you could imagine, when you have one positive case, we make the call for all close contacts, which we call a line listing. We probably get 10 to 15 calls. From there, we get 10 to 15 more. So this exponentially grows, and we need staff to do the good work, and we are, and we're making those calls and contacts daily. So about our public health response: stricter social distancing requirements, now referred to as physical distancing. We are encouraging social connections as much as possible with physical distancing. You heard today the City and County of Denver issued a stay-home order. We do have the authority to make a stay-home order in Larimer County. That's a local decision, but we have not made that decision at this time. I am pleading with our residents to follow strict social distancing and stay home if it's not essential. But I totally agree with the mayor. This is a time where we need to be neighborly. We need to reach out to all those around us, our friends, our neighbors, our family, etc. Make a call, FaceTime, whatever it is, reach out. We more than ever need to have that human connection, but we have to stay 6 feet apart. I know that's difficult. We're human beings, and that isn't really how we, behave, but we're going to have to do that. And I'm just stressing with everyone, please do that. Collaboration and communication in the region is so vital, and we are in a very blessed region where that's just normal for us. So we're working hard to keep you up to date on the changes and some of the challenges. We're working very closely with the city of Fort Collins and our other 7 cities to make sure they are aware of all the changes. Our updated messaging is on our website at larimer.org/health. Ask questions, come up in the community, we provide that information. We have a JIC, which is called a Joint Information Center, which provides text options, email options, and any other form of communication. We have staff in there that are manning that and returning calls. We also provide that in various languages, including Spanish. People want reassurance and guidance, and we have people here to answer questions and to give support. That JIC number is 970-498-5500. Again, 498-5500. With that, that was my update, and I'll turn it back to the moderator.
Thank you so much. Appreciate that, Tom. Thanks, everybody who's joined us on this live teletown hall. Remember that if you have a question you'd like to submit for Q&A, many of you already have, you can press 0 on your phone right now to submit that question, speak to an operator, and then you'll have the opportunity to ask it live. If you don't want to ask it live, just let your operator know you want me to read it for you. For everybody who pressed 7 to give us your email address, we got a little bit of a backlog there. I'll let you know when it's cleared, but if you already did press 7 to get email updates from the city, just hang tight. We'll get an operator with you very shortly. So let's get our first live question up from our audience. Chanel, you're live. Go ahead, please. Chanel, are you on the line?
Yeah, hi, sorry.
Right.
I muted it just in case the
That's
family
okay.
made a lot of noise.
No worries. Go
I
ahead.
ended up with 2 questions that I was kind of hoping somebody would ask one of them. Is it possible to ask 2 questions?
Sure, go ahead, Chanel.
Okay. First question is from Larimer County, the man that's working with health department. I have 2 friends that have called in, spoken to doctors. They have been confirmed over the phone as having COVID-19. They are self-isolating, and they have called their contacts and things like that on their own. But they never were tested, and they weren't even advised to come in for testing. Are those numbers being counted by doctors in the overall total?
Chanel, Tom Gonzalez, your Public Health Director. I appreciate those questions. The reason is, one, why the testing is we're so backlogged, and I think that's key and instrumental, and that's why I'm urging the governor and others to see how we can get more testing. That isn't unique to Colorado, that's nationwide. But to answer your question, currently no, but we are working on a system where we can get that information online. Some of our mountain communities have already provided that, so we would absolutely love to have that data. So we're working on getting that available online so that your 2 friends would be able to enter that into a system, and we would be able to get that valuable information. So I'm hopeful that's up and running very soon.
Thanks. And my second question is for Darren Atterbury. I actually sent an email about this. I have a loved one who is a current city employee, and this person obviously doesn't want to speak to this, but we received text messages that non-essential employees are off for the week because of the recent employee that was found to have tested positive for COVID-19, which I'm very thankful for because in the department he works in, there's a pregnant woman. And so I'm glad to hear that they're not coming in. However, that was overridden by his manager of his department, and he is going in tomorrow. So I'm trying to, and he's non-essential. So I'm trying to figure out what is the actual rule right now, and do you see yourselves closing down even the workshops and things like that? Because as of this point, people are making different decisions than what has been said to the public. Does that make sense?
Yeah, it does, Chanel. This is Darren. That was more than one question. Let me take a shot at it. First of all, as you've said, we did have an employee who did test positive and was hospitalized, and I learned earlier this morning that person is home and healing. So I'm very grateful for that, and if they're listening, I'm hoping you're feeling better. You're right. When we identified that there was a colleague at the city who did test positive and did show signs, there were two primary buildings that employee had been in. One was 215 North Mason, and the other was 700 Wood Street. We closed those facilities down, and they're going to remain closed through the weekend, through next weekend. So they'll be closed for a week, which means that important, and we have defined essential and non-essential, but basically the folks who need to be out delivering direct services let me just say that the building was deep cleaned over Saturday and Sunday. We are very, very closely monitoring who goes in that building and for what reason. There's managers outside the building as of this morning is what I was told, and being very limited on who has access to those buildings. There are people that are not entering the building that are required to be at work for essential services. And then there are folks who, to use those words again, non-essential, that are working from home. One of the things we are trying to do, being the fourth largest employer in Fort Collins, we're trying to model really best practices and lead by example so that other businesses will follow, small, medium, and large. I think we're doing that. If there's a specific concern that an employee has, look, we're creating, I hope, a very safe environment for them to express their concerns. They can share those directly with me, or they can share those with the Human Resources Department if they need to do that. But I feel like we've taken amazing precautionary steps, actually, and feel good about our work to date. As we're learning more and more best recommended practices, we're trying to put those in place.
Thanks for those answers, Darren and Tom. Appreciate it, and thanks for that question. Thanks very much for submitting it, both of your questions. And let's get our next one up from Mary Elizabeth. Mary Elizabeth, you're live on the line. Go ahead, please.
Hey, hi, it's Mary Elizabeth. I thank you for doing this. What are the measures, what metrics are being used to determine when we can lift the restrictions, when we know it's quote-unquote safe to resume normal life?
That's a great question. I appreciate that. This is Mayor Wade Troxel, and that's a hard one to answer, but I'm going to hand it over to Tom and then perhaps have some follow-up. Tom?
Yes, again, Tom Gonzalez, your Public Health Director. Mary Elizabeth, that's a tough one. That's the one we're really looking to our other countries that unfortunately are dealing with this, and they're probably 2 weeks to a month ahead of us. Here's what we know. It's a novel virus, so that means it's new. It's a mutated virus. Our bodies do not have immunities to it, and we do not have a vaccine for it. So we're all susceptible to it, which is that's unique compared to other like influenza, et cetera. So what we know is that the long term is it's probably going to be months, but the goal right now is to reduce the rate of amount of cases. Because the more cases we have all at once, as you can imagine, makes a medical surge. So we're trying to keep the medical community at a level we can treat COVID-19 and also treat our day-to-day medical routine issues. And that's the key right now. That's the middle of the mix we're in. We're making sure our medical community has the right personal protective equipment and enough beds and enough respirators. When we can get out of this, that's a challenging question. And as we get more information and look to Italy, to Germany, China, and see where they're at, I think that the answers will become in front of us. But for right now, we're trying to make sure that curve doesn't pop ahead, where then it puts a medical surge and strain on our medical systems.
Yep, and thank you, Tom, on that. And this is an ever-moving question, and I think we're into a very critical week or two because of as Tom pointed out, the rate of growth, and you also hear talking about flattening the curve. A lot of the concern right now is not only in the health of individuals and the potential those in the most vulnerable category, but it's really overwhelming our ability to serve those that need more acute care. And so by flattening the curve, basically our health services won't be overwhelmed in providing health care to those that are stricken the most. And so that's the near-term challenge that we're focused on is flattening that curve. And once that curve, they talk about there might be a couple of waves thereafter, and dealing with that. So there's the indefinite time, and the thing is addressing the rate of growth, as Tom pointed out, and flattening the curve, and then assuming, I think the social distancing in one way or another will be with us for some time to come, but then, I think that's where it's imperative on us to be working with our local businesses and those that will be suffering during this time. And so it's a very challenging time because it's very complex and it's open-ended. Next question.
Mayor,
Yeah, Darren? Go ahead,
Mayor,
Darren.
if I can just add for our residents who are listening in, on emergency events, typically we deal with snowstorms or floods or fires. We actually have departments that are built around these various topics. So when we have a snowstorm, we've got police, fire, and the streets department, and with usually close to 30 plow devices out. When we have fires, the Poudre Fire Authority we lean on in a heavy way, and floods and so forth. This event has been obviously a health matter. As I think about my 2,400 colleagues at the City of Fort Collins, there's not one person that is specifically dedicated to public health or public health policy. Now, from the utility standpoint, clean water and safe electric, those sorts of things, we have public health experts in that area. But as it relates to a pandemic, this kind of event, we don't have those resources internally within the city workforce. So what we've done with this event is, fortunately, we've had an excellent relationship with Tom Gonzalez, who is our new county director, relatively new, within I think a year or so, maybe two. But we've relied on Tom and his staff. They're professionals, they're experts in this area. We've relied on the state of Colorado and their public health experts, and then also the experts in the federal government at the Center for Disease Control and others. So we have been, the question was about benchmarking. I can tell you, as it relates to our response to these events, whether it's declarations of emergencies or shut-ins or, physical distancing, those kinds of things, we've relied heavily on those experts.
Thank you, Darren. Next question, please.
Sure thing. Let's get Lynette up live next. Hi, Lynette, you're live.
Hi. How are you?
Good, Lynette. Thanks.
Okay, I just want to know, since the rise of utility costs between 5 and 9 p.m., how are you or the city of Fort Collins going to manage to downgrade the cost, because families are encouraged to stay home and, feed their families, electricity and everything like that? What's that?
You bet. I'll start off. Thank you very much for the question. That's regarding our time of day rates, and we're currently in the winter rate structure, which will be in place until April 30th, where The time of day on peak hours are from 5 p.m. to 9 p.m., and that's only on weekdays, so that's 5 days a week. At this time, the time of day pricing will remain as is. The council recently heard a one-year summary report on the impact of time of day rates on ratepayers, on our citizens, and actually found that 66% of our ratepayers actually ended up paying less because of the way the time of day rate structure works. And so during this time, if many that will be at home during the day, you will actually see there will be a benefit where your prices are actually 70% lower during the day. So the one aspect of the time of day rates is most of the day your rates are 70% less than what they were previously. And so I think what it does put some cost control in your own hands if you're able to manage your electric usage for that period. And so just some other points that I think are important with regards to utilities and difficulties in at this time. Fort Collins Utilities will not disconnect any service to customers until a further notice of non-payment. And if you're having difficulty paying your bills, please contact utilities to receive assistance or make a payment arrangement. And you can go to the Fort Collins Utilities website, fcgov.com/utilities and COVID-19, and you can have more information there. Or you can call Utilities Customer Service Line, and that will be open by, and the phone is 970-212-2900. So I hope that addresses it, and I think it does put some control in your hands to actually reduce the impact based on the time of day that you use your energy.
And Mayor, if I may just add, this is Darren. With the time of day rates, actually, daytime off-peak rates are significantly lower. So if your demand increases in the mornings or middays, those rates are going to be significantly lower than the peak. And most people who are staying at home because of work will benefit from those lower rates.
Thank you, Darren, for that. Next question, please.
Sure thing. We've got Reese up live next. Hey, Reese, you're on. Go ahead.
Hello. Thank you. My name is Reese, and I was wondering, I've heard numbers about how many people are infected and things, but I don't believe I've ever heard, and I know this is a constantly increasing number, but approximately how many people in Larimer County have been tested to present? And number two, do you anticipate that this is probably the end of the school year for public schools in Larimer County?
Tom, why don't you start off with the first part?
Yeah, Reese, thanks for your question. That's been one of the frustrating challenges with testing is we don't have a denominator. So I don't know how many individuals have been tested in Larimer County. We are getting now some numbers overall in the state, which last number I saw was 5,500, and that probably just changed in the last minute or so. But that's been the challenge, and we have voiced that challenge to the state. We know they are working on that, but as you can imagine, they're just trying to get ways of testing. This is a new virus. It's a new test. It's had its challenges. So I can't give you a denominator. That is very tough as your public health director because that's so important when we're talking epidemiology or study of disease. As far as with the schools, we'd be speculating because it's every day it's changing. If we believe there's still a concern that this rate would go up where it would have a medical surge, and then that would lead to what we're calling stress on that system, those schools will remain closed. So for right now, that would be me speculating on when those schools will be open or if it's going to be at the end of the school year.
Thank you. Ian, next question, please.
Sure thing. Thanks for that question, Reese. And we've got this one. It's come from quite a few people. Judy, Taylor, Max, you're all asking this question. It's about a potential stay-at-home order and what the city's plan is for the potential for a stay-at-home order and how that would be rolled out.
Yes, Darren, would you like to start with that?
Mayor, I actually think it might be best for Tom to go first, and I'm happy to backfill.
Okay, sure. That's
Yes.
good to put in context both what the state and what happened
Right.
today with Mayor Hancock.
Yeah, thank you for that question. That's a good question. I've been on phone calls with many of our Metro public health directors on trying to learn as much as I can on incident rate. Again, without a denominator, that's hard. We're right there learning about what Mayor Hancock and the city and county of Denver issued a stay-home order. We are having those conversations at a state level. I'll be very honest with you, because we need to know what's going on. We're trying to get information from the governor's office to see where the administration is with that. We do have the authority here under public health orders to do a stay-home order, but we're trying to see what's the best. What is the best way to keep that curve down? And we haven't made that decision. What I am pleading, I'm just pleading, residents, please, you've got to follow the strict social distancing and stay home if it's not essential. I'll be honest, we got complaints today, and it's going through our complaint group that folks aren't doing that. Now, some of those are not substantiated, but others are. So if I keep hearing that folks are not following our social distancing orders, if folks are not really doing the stay home that we're urging, then that may have to elevate. I'd rather not have to do that, because I believe most of our residents are all following this and all trying to learn and keep 6 feet apart. But the goal is, the only what we call medical countermeasure is social distancing. So we all have to go to the grocery store, but perhaps only one person in the family go. Maintain your 6 feet. Check on your neighbors, see if they need something, especially are more susceptible, over 60 years old, or those that have underlying health conditions. So really right now, I'm just pleading for our residents to follow the orders. If they follow them, we'd be able to lower that curve, and we would maintain that social distancing, which would slow the spread.
And I would just say right now, the guidance that we're following is clearly working with Tom, and it's really the guidance provided with the governor's lead. And right now, that is proactively taking steps to reduce the workforce by 50%, trying to work at home. And we're modeling, as Darren pointed out, at the city, that action as well. And so getting to the bottom line of Tom's comments was, the pleading about social distancing, and that's key. And right now we're following the direction that the governor has set. Next question.
Mayor, the only thing that I would add, if people are I know there are some in the community that are urging a stay in, and then there are others who are really worried about the impacts of that. And I just would add, yesterday, as a large employer, we heard the governor talking about the 50% rule. At the city, we're driving to get to 25% or below. And that's a very, very difficult challenge. But I think to Tom's point, if you're of the mindset that you'd like to see this avoided, then I think playing by these rules and these guidelines is going to be very, very quick. So my challenge would be to, small, medium, large businesses. Some are already shut down, and there's serious ramifications. But or if you're an employee in these small, medium, or large businesses, to look to best practices and to try and, what I say, exceed the governor's strong urging and Tom's urging here That's the only way that this can be avoided, and I'll leave it up to the public health directors to determine whether or not, that's put in place or not.
Thank you, Darren. Next question.
All right. Thanks, Mayor. Thanks, everybody. We're going to get our next question up from Nate in just a moment here, but we've got a little break here. We've got about 20 minutes left, and we finally cleared the collection queue for emails. So if you want to get email updates from the City of Fort Collins moving forward, press 7 on your phone right now. We'll do our best to get your email address before the end of the forum. Again, you can press 7 if you'd like to get email updates. Also, grab a pen and paper. In a little bit here, I'll read an important website for you to visit and the phone numbers that you've been hearing, the Utilities Customer Service and Office of Emergency Management phone numbers. I'll read those when we get closer to the end of the call and give you a chance to write those down. So if you didn't get a chance already, grab a pen and paper. We'll read them again. The website is fcgov.com/coronavirus. Again, I'll read all that information again when we get to the end of the call. For now, we've got our next live question coming from Nate. Hey, Nate, you're live. Thanks for waiting. Go ahead.
Yeah, hey, transit agencies across the state are limiting service or even cutting service, or limiting how many people can board the buses just for physical distancing. Is transport planning on implementing any of these service changes or limiting the number of people on board? And I guess special attention when there's a lot of need for people to access medical services right now. Just what transport's thoughts are on this.
Darren, would you like to start that?
Yeah, I'm happy to, and that's an excellent question. And it's a really good example of a service that some may consider deeply essential that the city provides. So you can imagine a person whose job is at risk or their lifeline is their job, and they don't have access to transportation for various reasons except for public transit. So us eliminating public transit, and I know you're not advocating for that, but I want to just sort of give a few scenarios. If we shut down transit service, those people who rely on this essential service to continue to do their jobs, to get to health care, things like that, we talked a lot about that and chose to keep transport up and running. It is also free. I've made the decision to, over the next 30 days and with council's ratification, to not have a fare because of how critical transit is to people at this point. Now, I will tell you, to the question of physical distancing, absolutely. We have serious guidelines in place. We've got signage in place. We've got new devices on some of the routes or on the buses. So we're asking people to enter the bus towards the back, away from the operator. We're asking them to keep physically distant, and we're also watching the number of people that are actually on the routes. So, and our operators are, I think, doing a fine job in reporting back any problems with that. So I feel very good about the work that's in place at this point. But I will say that in very short order, we are looking at the reduction of transit services, of some of the services. We do reduce our bus line service, or our bus service, when CSU is out of session. And so we're already in a reduced level, but we are expecting to look at further reductions. But the elimination right now, based on what I previously said, I think is just it could cause more damage than good.
Thank you, Darren. Next question.
Sure thing. Let's get our next one up live from Dr. John Morse. Dr. John, thanks for waiting. You're live. Go ahead.
Yeah, hi. During this crisis, a lot of different people may be feeling some anxiety and depression. A lot of our local therapists have already set up something called telehealth or teletherapy, but I wanted to see if you could make sure that people knew how to access emergency mental health or psychotherapy services.
Hi, John. Good to hear from you, and I'm glad to have you on the line. So, Tom, can you start that?
Yes, Dr. Morse, great to have you on the phone. This has been really my push and the staff's push probably since this weekend, really looking at behavioral health, mental health. How can we get this information out. And I'd definitely love to connect with you offline, because we've got a group within a strike team in the Emergency Operations Center, but any other ideas, ways we can get that out to our residents, that would be fantastic.
Sure, I'd be glad to.
And just to kind of point out a couple of other essential services, John, you pointed out a critical one, and there'll be more information that we'll post on that. In terms of child care, Early Childhood Council and the Larimer County Department of Human Services are the lead coordinating organizations there. And current focus is identifying child care support for healthcare staff and first responders. There's also been a lot of activity related to food insecurity within our community and those vulnerable populations. And first of all, the food bank is they're being strained in terms of their resources. So anything that we can do to provide them some financial resources to help in this time, which is straining their current ability. And then the Poudre School District students will be able to pick up a sack lunch if they're on a reduced if they're able to do so. Pick up a sack lunch. That also includes food for breakfast in certain locations starting actually today. So that's good news. Any other comments related to mental health and food and child care?
Mayor, this is Darren. I have just one comment, and I'm with Tom. I love the fact that this person just called and shared that. I think it's so critical as a city planner and city managers, and I know I can speak for our mayor and city council, both current and of the past. We use the word sustainability often as a city, and for many years we've talked about what makes a city sustainable is its financial and economic health, certainly its environmental health, and then its social health. And I think the caller is really talking about the social health of our community. And, there's so many opportunities for people to give, whether it's through Adopt a Neighbor or some of the programs that we've mentioned here. But, I was on the phone with a council member earlier today who was really expressing concern to me about elderly residents in apartment complex who are not in a living, assisted living program, but they just live in apartment complexes, and who's checking up on them? And so we, through volunteers and various folks in the community, people are going to be knocking on doors and putting door hangers on. And so not only can you adopt a neighbor, but someone can be requested to be adopted. But, I've been in Fort Collins for almost 25 years, and this community is amazing. And the caller who just spoke really, I think, reflects the soul of this community. And we have got to be looking out for each other and our physical health, but also just our mental health as well. So I'm really appreciative for that caller.
Thank you,
thanks
Darren.
so much, Dr. Morse.
Thank you.
Appreciate you being on. Let's get our next question up there. We've got this one from Matt, who's asked me to read his question. He says, my wife and I own a local business. As we're going through this situation, we've been going through different avenues to reduce costs. What can the county do to encourage building owners to reduce rent costs to what is only essential to cover their overhead, whether that means just making landlords aware of the local situation or incentivizing assistance? And again, that one's from Matt.
Well, thank you, Matt. Clearly, our businesses, and particularly we made up the small businesses in our community, are critical. And there are a number of things that are happening related to small business support. First of all, Governor Polis is asking companies to allow for up to 90 days in payments, asking landlords not to charge late fees for rent until April 30th, and asking law enforcement not to use resources to respond to foreclosures or evictions. And if our economic health office is responding to a number of things, questions coming from our small businesses, and if you go to, again, the fcgov.com /COVID site and the small business, the city has approved the creation of a small business relief and recovery loan fund in cooperation with the Colorado Lending Source, a Denver-based nonprofit community lender. And there's other things happening at the state level and also at the federal level, which those are still pending. But there's at the federal level, there's the Small Business Administration disaster assistance, where working with the Colorado small businesses impacted by the COVID-19 can now seek individual small business loans up to $2 million as a part of the Small Business Administration's economic injury disaster loan program. And Larimer County is a designated area for disaster relief. So there are a number of things going on, and there's resources, and our economic health office can help connect you to specific sites. Let me correct that website as fcgov.com/business, and that has the SBA resources that I just mentioned.
Great. Thank you so much. Much appreciated for that answer. And Matt, great question. Really appreciate you coming in and asking that in our forum today. Let's get our next one up. We've got Brittany live next. Brittany, you're live. Go ahead.
Hi, this question is about Park and Rec. While I believe it's helpful for all of us to get out and walk or bike while maintaining social distance, I wonder if the city or county will be closing playgrounds and outside areas where people tend to socialize.
Darren, do you want to talk to the parks and the closures and city facilities in general?
Yeah, I will, Mayor. Thank you. Thank you, Brittany. It's a great question, and I was on a call earlier today getting updates about how things are looking in our parks and our natural areas and our various sites, trails, and so forth. And again, when we talk about the social and physical health of a community, parks and recreation and culture all matter so much. Early on, and you may know this, early on, I was faced with a decision and supported by council to close down our cultural facilities and our recreational facilities, the Northside Center, the Epic and Mulberry Pools, but we made a very intentional decision to leave the parks and the trails and the natural areas open. We are having some concerns with people who are going on trails that are prohibited right now because of mud. So if you're one of those people, please only stay on trail. And not the speaker, I'm saying if someone's listening. To date, we have seen very good behaviors at the parks and the trails, and we're asking very intentionally for people to physically distance. What I heard earlier today is that that is happening. We're asking people to use wipes, and we're asking them to keep kids and people who are playing distanced. So as of this afternoon, people are heeding the advice of our staff and of public health officials. My intention, and I think our staff's intention, and I've heard nothing to the contrary from the mayor and city council, is if we can keep those parks and trails and playgrounds open, then we're gonna do that. But again, it gets to what Tom had said. If people will please be respectful of those requirements and those guidelines, then we're going to keep them open. If that becomes a problem, then we will be forced to shut them down.
And Darren, I'll just follow up. Thanks for that answer. I was contacted today by a gentleman asking about the golf courses, talking about how social distancing and groups of less than 10, and why are golf courses included in the closure? That might be something to think about.
Yeah.
Darren?
Mayor, we have, I have not had a conversation about the golf courses today, but last week I spoke with our Parks Director, at length about that issue. Obviously with the, pro shops and the restaurants and so forth, we just can't have those open, but, we're looking at the golf courses as if they're parks right now. And we know that people are walking through the golf courses and using those. We are not prohibiting people from those. But because of the sort of the beginning and the ending of the golfing, there's regular contact, and we made an informed decision and chose to close those. But I hope that our folks will see, as long as they've not been prohibited, I hope that we'll see people out in those facilities and enjoying them and getting fresh air.
Well, thank you. And I think we're about ready to wrap up. Is that right, Ian, on our time?
Yeah, and I'd like you, Mayor Troxel, if you
Okay.
would make some closing comments in just a moment here. First, I'd like to read all of the important contact information, and then I'd like you to take us to the close, if that's all right.
That'd be great. Thank you.
Sure thing. So grab a pen and paper. I've got all our important websites and phone numbers for you that we mentioned during this call. First, we mentioned the Larimer County Office of Emergency Management. That phone number is 970-498-5500. Again, the County Office of Emergency Management number 970-498-5500. The Utilities Customer Service line is 970-212-2900. Again, that's 212-2900 for Utilities Customer Support. And then for general information on the coronavirus, and also to sign up for email updates about the coronavirus from the city. If you didn't get a chance to get your email address collected from one of our staff tonight, you can go to fcgov.com/coronavirus. Again, that's fcgov.com/coronavirus if you'd like to learn more, and also you can sign up for email updates there. Again, fcgov.com/coronavirus. And finally, we also mentioned fcgov.com/business. For those in the business community who are looking for information and resources, you can go to fcgov.com/business. So thanks again, everybody, and I'll turn it over to Mayor Wade Troxel to take us to the close.
Thank you, Ian, and thank you all for joining us tonight. We have a great community. We have a community that's being responsive. We have a very caring community at this time that it's impacting everyone in our community. I think the first and foremost that what each of us can do is to be responsive to the social distancing and as best we can to shelter in place and to follow the guidelines as prescribed by our governor and our county health director, Tom Gonzalez, and working in concert with our communities here in northern Colorado. And Tom, I want to thank you for all the work that you're doing. And with that, each of us taking a personal responsibility and with our families and those in need within our community. As we move forward in this uncertain time, basically, we are committed to communicating the best information that we have that's in and working as a council and a city manager's office and the entire city organization to be responsive to our community and to first and foremost the health in our community and also the economic health in our community as well through our businesses and really trying to assist and work for the best of all in our community. And then while we're doing that, think of the most vulnerable in our community and the kinds of things we can do, whether it's neighbor to neighbor and the outreach that they provide to help those not to become homeless, to provide that additional carryover rent and so forth, to the food bank and others, and through child care services and so forth. We are in a very difficult time. I think we have a great community that can really come together to help all of us weather the situation. And with that, I want to thank Tom, I want to thank Darren, and also I want to thank Ian for your moderation here tonight, Ian, and thank you all for being with us tonight, and continue to we'll have a conversation to answer the questions that arise within our community.
Thanks again, Mayor. Thanks everybody for joining us, and have a great night.